Have you noticed that your teeth aren't lined up like they used to be before? I'm Dr. Scheurer from Tranquil Dental, and I had a patient last week who brought me these beautiful orchids, and they're all lined up perfectly. So I started thinking about how many people may be noticing that their teeth aren't lined up like they used to be. Maybe your teeth were always naturally straight in a row. Maybe you had braces and they were nice and straight when you first had your braces removed. Maybe you wore a retainer for a while and then stopped wearing the retainer. If you've noticed that your teeth have moved, if they seem like they're in a different position for you, you're not experiencing something unusual. There's actually a natural phenomenon called mesial drift, where your teeth tend to shift forward. So if you don't have something holding your teeth in place, they will naturally try to crowd together and come forward. So if you're noticing that your teeth seem to be shifting, maybe there's a certain tooth that seems like it's out further or back further or rotated, maybe they're kind of gathering together, that's not unusual. If you have places where your teeth are shifted together, sometimes you'll notice it even more so on the lower teeth than the upper teeth, although it can happen everywhere. It can create a number of different problems. So one of them is that it's very difficult for you to be able to clean those areas. A second problem is that the hygienist can actually have a difficult time accessing some of those areas when those teeth are crowded together, bunched together there. So you can have some calculus that'll build up, those hard deposits you get on your teeth, which of course cause bone loss. So you can have resultant bone loss from it. And then if you have plaque, bacteria accumulation that's in between those teeth that are crowded there, it's an area where you can get decay. So really it's not ideal for them to be in that crowded position. It's really much better for them naturally to be straightened. It allows you to clean them more easily. It helps to prevent decay and bone loss and calculus buildup. If you're noticing that your teeth are crowded together or rotated, here's a little example how the teeth, you can see they're kind of sort of all shifted a little bit in different positions. It is much more ideal for them to be all lined up in position. So you can achieve something like that through either traditional braces, but you certainly can achieve it also by Invisalign, which is a clear tray that goes on the teeth. And when it's in position, you really don't notice it. You can take the tray out, eat whatever food you want to eat, go ahead and brush, floss, clean those areas, and put the tray back in. And through a series of trays, you're actually able to move those crowded, shifted teeth and get them back into a straighter position. It's really important to be able to have them all lined up so that you can try to prevent all the problems that occur, and then to hold them in that position with a retainer. Sometimes you can have a retainer that looks like a Invisalign tray. You're already accustomed to wearing that, and so you can wear a retainer that looks very similar to that. Just pop it in at night before you go to sleep and wear it all evening, and that will easily keep those teeth in that same position where you're all lined up. All those teeth are all lined up naturally, and that will help to prevent the calculus buildup and the bone loss from the crowded teeth and the decay that may occur there. So if you are noticing that those teeth are crowding together, that you hadn't recognized it before, it's not unusual. You're not crazy. It's something natural called mesial drift. So you want to try and prevent that from occurring anymore. Kind of get the teeth in the right place and hold them there.